Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. I'd like to start today with our COVID update. Globally, we have 125.7 million cases, and deaths, we have 2.76 million cases. In the United States, we've had 30 million cases of COVID-19, and to date, 547,000 deaths. Our sympathies, of course, go out to family and friends of those who have lost someone to COVID-19. In Nashua, our total cases to date are 6,835. Our active cases are 210. Our new infections per 100,000 are 333.5. This number has gone up significantly in the last week. If you'll notice on this graphic, it is red, which puts us into substantial community transmission. Also noticeable on this graphic is that our test positivity rate in Nashua is 7.3%, which is up a couple percentage points from last week. And that is why it is in yellow, not quite red, but starting to become a little bit more of a concern. The total cases to date in the greater Nashua region are 14,917, with 501 deaths being reported. If we want to understand the percent positivity, we look at the number of positives over the number of tests in a given week. This week in Nashua, we are at 7.3% positive. In the state, it's a little bit lower at 3.4% positivity. You can see that this, on the far end of the graph, that the right part on the far right, it's starting to tip up again. So we are seeing an increase in the state of COVID-19 cases. So we want to remind you that we still want people to get COVID tested if you are feeling symptoms of COVID-19 or if you've been exposed. If you develop symptoms, cough, shortness of breath, fever, congestion or runny nose, nausea, vomiting, fatigue or muscle ache, or loss of taste or smell, or been exposed to another case of COVID-19, please go and get a COVID test. If you are exposed, we ask that you stay home and avoid contact with people outside of your household for 10 days. Watch for symptoms. Get tested 5 to 7 days after you've had that close contact. Please get tested in a medical office or at a clinic. Do not use the emergency room for testing. And please also, if you've been exposed, complete your 10-day quarantine, even if the result of your test is negative. If you need a COVID test, we do offer COVID testing from 3 to 4:30 in the Elm Street parking garage. You can do that by appointment. You can call 589-3456, or you can go to the Division of Public Health website, click on testing, and there'll be a giant button there where you can make your appointment. We encourage you to come with an appointment, although we do accept a limited number of walk-in appointments as well. So all the buzz this week is about vaccination, and there's a lot of vaccination going on in our city and in our state. The state has created this amazing vaccination dashboard, and you can see that vaccination is definitely going up over time. Each and every day, they are adding, and we have an upward trajectory. So why get vaccinated? Well, we have a few reasons. COVID-19 is much more likely to cause long-term health problems than the vaccine. The COVID-19 vaccine primes your immune system, and then it leaves your body. More than 90% of the doctors who have been offered the vaccine have chosen to get it. And the more we vaccinate, the faster we can get back to growing our economy and doing what we want, seeing friends, seeing family, celebrating milestones, graduations, proms. If people get vaccinated, we're going to save at least 100,000 lives of Americans who would otherwise die from COVID-19. So many people ask, how effective is each COVID-19 vaccine? So we just want to reassure people, and hopefully you can read this graphic, that all of these are 100% The Pfizer, the Moderna, and the Johnson & Johnson, 100% effective against death. And there are differences against severe infections. Pfizer, 75% effective, Moderna, 100%, and Johnson & Johnson, 85% effective. And against all infections, we have a high rank for Pfizer and Moderna at 95% effective and 66% effective for Johnson & Johnson. We're not offering choices in the state of which vaccine you can receive. What we do suggest is that people take the vaccine that is offered to them and to set their appointment as soon as it is available. We've had big news in New Hampshire. Right now we are in phase 2A and 2B. We are working on school teachers, childcare providers, and those 50 plus. On Monday, March 29th, 40 to 49-year-olds can sign up for the vaccine. And on Wednesday, March 31st, 30 to 39-year-olds can sign up for the vaccine. And on Friday, April 2nd, woohoo, all 16 plus can sign up for the vaccine. So I would imagine that when you sign up, the appointments will be scheduled out a little bit. So what I ask and tell people is please be patient. So after the vaccine, we have 3 Ds: distance, density, and duration. We still want to keep our distance from people 6 feet if they're not living in our household. Density, avoid crowds, indoors, outdoors. You don't need to be so close to people. We can still communicate. And finally, duration. Try to avoid close contact for more than 10 minutes with any one person outside of your household. For more information on vaccines, you can visit vaccines.nh.gov. And if you're eligible, you can sign up right from that website. We'll be right back with our special guest. Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And today I'm joined by Jen Morton, Coordinator for N68 Hours of Hunger. Welcome, Jen. Thank you for being here.
Thanks for having me. It's an honor to be here.
So happy to see you in person. We usually, I guess in the old days, would run into each other a little bit more often.
Yes.
And we would hug. But we're not
None of
hugging
that
these
now.
days.
No.
You are my hugging friend. And anyway, you're the coordinator for N68, among other things. So we're here to talk about that and the role that N68 fills in the Nashua community and through the Nashua schools. Mm-hmm. So can you just explain what N68 Hours of Hunger is? And I know it's a national organization and you're a local chapter, so we'll just start there.
Exactly, yep. N68 Hours of Hunger is a food program for children 18 and under who face food insecurity at home. So the 68 hours in the name of our organization represents the time that children would have free lunch on Friday until the time that they'd come back to school on Monday and get a free breakfast. A lot of children living at or below the poverty line are facing food insecurity at home. Oftentimes they qualify for free and reduced lunch at school, which provides them 10 free meals a week, balanced meals a week. So what we try to do is fill pre-pandemic that time on the weekend when they would face the food insecurity at home. Our bags used to have 7 meals and 3 snacks in them for Friday night's dinner, all 3 meals on a Saturday and all 3 meals on Sunday. Mm. Obviously, since the pandemic and the school shut down, school lunch isn't as readily available. Mm-hmm. Nashua schools have done a great job providing school breakfast and lunch for free throughout the pandemic. But depending on a family situation, they may or may not be able to actually get to the school to get those meals, pick them up. Without busing and a regular schedule to get to school, it made it more challenging. Yeah. So we increased the size of the bags that we give out. So we're currently giving out between about 14 and 16 meals a week and 5 or 6 snacks.
To each family?
To each
Or
each
each
child.
child.
Yeah, each child and each family. So if you have a child in 1st grade and 5th grade and 7th grade, they all qualify for their own bag.
Wow.
Again, this is non-perishable food because of the way we pack the bags and the bags are distributed through school locations. It may be that, sometimes there's a snow day or children are sick or the family's not able to get to the school for any reason to pick it up. So sometimes our bags may end up sitting in a corner office at school
Sure.
for up to 2 weeks at a time. So we can't have anything that's gonna be crushed or spoil while it's waiting to be picked up. So some of the items we include are tortillas and soup and canned fruit and canned vegetables.
Peanut butter
And jelly, of course. Tuna, macaroni and cheese. Different items that are easy for children to prepare too. So canned spaghetti or pasta, things like SpaghettiOs or Chef Boyardee ravioli, those are popular. Oftentimes they have a pop-off lid and the child can just dump it into a bowl and put it right in the microwave, and that's a quick and easy lunch. We're looking for things that fill children's bellies. And then we partner with different agencies in the community, especially the Nashua Soup Kitchen, other food pantries, the United Way, the New Hampshire Food Bank. They do mobile pantries for fresh fruit and vegetables.
Okay.
And produce and milk. So those kind of things in partnership with our bags that are going to the children can make a well-rounded meal for the families.
Because you need a little milk to go with your mac and cheese or to make your mac and cheese.
You would hope so, although it can be made with water.
Yes, I know.
so.
I've done both. As a college student, I've done it all.
That's right.
So we've all learned that. So let's just back up to pre-pandemic, because those are the days where I was involved with N68, and there was quite a system when you went down there. Yes. You were in pretty tight quarters. Thankfully, the United Way gave you that space.
Yes,
but you quickly
generous.
outgrew it.
Yes. So we were with the United Way for about 3 years. They were wonderful hosts, very generous, had a lovely space for us downstairs in the basement of their building on Broad Street. We moved about 1,500 pounds of food up and down a flight of stairs every week. We set it up assembly line style in the room, and on Wednesday nights pre-pandemic, we'd have a crew of 20 to 25 volunteers come in and grab bags and assembly line style, just go through the line, put something in every bag, carry it upstairs. The schools would pull up and take it away.
And that's what amazed me, because I think that people really should understand what a community effort this is. Because you have teachers picking up those bags.
Exactly.
So the dedication of those teachers just really amazed me. And I know it continues during the pandemic.
Right.
But pre-pandemic, you would have the teachers come and loading up their cars with these bags of food for the kids.
Right.
That's amazing.
On a Wednesday night at 7 or 7:30 p.m., like, they'd worked all day, they were tired, sometimes they'd show up in their pajamas. It was
no judgment.
Yeah, exactly. It was like, I'm chilling out at home and it's my bedtime, but you know what? I want to make sure the kids in my school are fed, and so I'm going to drive out in the snow or the rain and pick up those bags of food and bring them to the children tomorrow.
And kids do spend an awful lot of time in school pre-pandemic. And the teachers are often their first line of, really understanding what's going on at the home, if a child's hungry.
Yep.
And if a child's hungry, they can't focus in school.
That's right.
I mean, absolutely impossible. If any of us are hungry, we can't focus on our task at hand.
Exactly.
We get grumpy, might misbehave, might get tired or sluggish. So I think it's really important from a health perspective, people understand it's just such a basic human need.
Exactly. Yep.
So I noticed that. So are the teachers still, what are they doing now? Or are you delivering them on buses, or
so
how's it working?
We've done a little bit of everything. Obviously, when the schools shut down, there was a momentary panic of, oh my gosh, how is this going to work now? But really, again, to the teachers, the nurses, the guidance counselors, the social workers, the homeschool coordinators, the administrators at the school, we have to give all the credit of making sure that this program met the needs of the families in their schools, even if the children weren't in school. Right away, they all switched to a hybrid model of teaching or a remote model of teaching, and nobody was in school. And they found ways to communicate with their families to come and pick up the bags at school anyway. Like I said, the Nashua School District did continue the free breakfast and free lunch program. So
And they
often,
delivered that on the buses, didn't
some
they,
of them
for a
did get
while?
delivered on buses. Yeah, most of them were at the schools. You could go to the school and pick things up. But yes, they're with the United Way, they coordinated bus routes throughout the city, especially for the summer and the fall. And some of those bus routes also included produce stops with the mobile food pantries. It really is a community effort to end childhood hunger in Nashua. And we're really lucky in this city that we have a lot of partner agencies that can support this program. We meet regularly. We talk about where we think the holes are and who's not being serviced, and it's a great effort, and it seems to be working. And really, the teachers, administrators at the schools kept in touch with a lot of their families, most of their families throughout the pandemic, even over last summer, and made sure that they were still getting the food they needed.
And let me just interrupt, which schools are you servicing right now? Are you able to do all the Nashua schools? Or?
So yes, we have made our services available to all the Nashua schools. However, at the high school level, we're not seeing quite the need that we anticipate is really there. So
Okay.
Some of it may be that the kids were remote. Nashua North actually had its own food pantry pre-pandemic.
That's right, I did read about that.
So they were taking care of the Nashua North students pre-pandemic. During the pandemic, of course, they didn't have kids in the building, but they knew that some families still needed help. We have taken in a few high school families into our program, but certainly not that many. There are probably more hungry children out there, and we always say just feel free to reach out to us. We can connect you to a school. We also give out our bags through the Nashua Public Library. So if you're ever headed to the library and your family needs extra food, all children 0 through 18 qualify for a bag. So,
So do you leave extras there,
Yeah.
or is that how that works? And the demand is there. People are picking them up there.
Right. And it's kind of a small and sporadic demand right now, but that is a local resource. You could definitely go into the library, let them know how many children you have, that you just need a little extra food at home. They'll give you the bag to take home with you. And also Lamprey Community Health Center, they have our bags as well. So if you have an appointment with a pediatrician and you let them know that you are having a hard time this week, just need a little extra food, they have our bags ready and available to.
Wow, you guys are everywhere.
We're trying to be everywhere. Our goal is to end childhood hunger in
Yes.
Nashua, and all of those places are where children are. And
Yeah.
so throughout the summer, we try to partner with Southern New Hampshire Services,
Okay.
and they go around to the pools in the city.
Oh,
and
so that was my next question. So you're just doing this perfectly.
Okay, great. So yeah, they bring the free breakfast and lunch program that normally you would get at school to places where children will be in the summer. So city parks, city pools, they have free breakfast and lunch from the FDA and USDA. And so then we have our bags there available to give out as well. So it's a big community effort. And we're really pleased with the partnerships that are happening to try to end childhood hunger in Nashua.
So I approached you a while ago asking you to apply for a grant, and you said your donors have been so generous that you were going to pass. So tell me about your donors, and feel free to give a shout out to some of them, because this is really like an amazing thing, and I don't think people realize often. They think about like the weekend.
Right.
We're taking care of kids during the week because they're at school, and then school closes, and this is complicated for families, and you don't even think about, there's no food at home on the weekends.
Right, exactly.
So
yeah,
tell me about your partner. I mean, not your
our donors.
Your donors,
Yeah.
and how we can donate.
That would be great. Our donors are amazing, and really the thing that really buoyed us through this year was, as the pandemic shutdown happened, we had an anonymous donor come forward nearly right away. Within the first week of the shutdown, and they said they'd like to give a generous donation immediately, $12,500.
Wow.
Which was a huge amount of our budget at the time. And so, of course, we gratefully accepted, but then they added to that and said, we will match another $12,500 if you can raise it. So basically, this one donor came forward and said, basically, if you can raise $12,500 from the community, then we will give you another $25,000, so a total of $37,500.
Amazing. So did you do it?
We did it, and honestly, we did it in record time. Like the donor said, how about 30 days? Maybe that'll be enough time. And don't worry, we can, fudge with the deadline if we need to. And so we were, okay, we'll publicize this, we'll get it right out. And we did. And our private donors, our community donors have just been amazing all throughout the years. But they really stepped up, and social media is a huge ally of ours.
Right.
People were sharing our posts. The Nashua Teachers Union shared our post. And so we just reached so many people so quickly that we had raised $12,500 in about 54 hours.
Oh.
It was like just over 2 days.
Not even 68 hours.
It was so humbling, and it was so emotional for us that we could have that kind of community support around the program.
And it makes you realize what a special community this community is.
Exactly.
How generous they are. People have been digging deep, because I think when the pandemic started, people really think, what can I do? How can I help? If you are fortunate enough to keep your job, if you're fortunate enough to stay healthy, what can I do to help those that are less fortunate than I? And, this shows in this kind of effort. You're a small grassroots kind of organization. I don't think you ever sleep, but I don't think
We do.
Yeah, eventually. But
yes, so those kind of donors and the people who just give $10 a month ongoingly, that really buoys our spirit. No one wants to see children hungry in their own community. That kind of donation at the time was nearly 2/3 of our annual budget.
Wow.
The year before, the 2019 school year, 2018-2019 school year, we had, our budget was around $38,000. Or no, it was close to $50,000. So to make that much money at that
such a short time.
right, was wonderful. What we didn't realize was that there was going to be a shortage of groceries about 2 weeks later.
That's right.
We hit this major kind of stressful stumbling block in that we had money in the bank because of all these wonderful fundraisers, but there were no cans on the shelves. There were literally
you're
no
right.
soup, no pasta. These are things that we give out every week. So we had to be creative in the ways that we sourced for food, and we've now have started ordering from U.S. Foods, which is usually a restaurant and hotel distributor. So, it's kind of
And they weren't busy.
Exactly. It's kind of a symbiotic relationship in that,
Right.
they were glad to have us come on board because some of their business had dropped off. But the things that we buy for them are more expensive than the things that we would usually get from a Market Basket
Sure.
or an Aldi. We also get food from the New Hampshire Food Bank, which
Right.
makes our money go so much further.
Right.
Because,
That's an amazing resource.
Yep, they supply food for other nonprofits throughout the state of New Hampshire. So the food that we get from them just costs us about 9 cents a pound. So
Which, just to put it in perspective, like if you have a big jar of peanut butter, if that costs you 9 cents,
exactly.
that's really a good bang for
A
the
bag
buck.
of pasta. When the pandemic hit, we were feeding about 325 children a week. We now feed about 480 children a week.
Wow.
And one bag of pasta at the Market Basket would cost you $1. It costs us 9 cents. So 480 bags of pasta we give out every week at 9 cents a bag.
That's amazing.
Yeah, it's a huge help for us. So we make all the money go a long way. We really budget well. We try to be conservative in what we're providing, and yet still, get the calories out there, get the food out there. The other thing about our organization is that we are all volunteers. Nobody gets paid to do any of the work that we do. And the space that we occupy now, because we did move on from the United Way building when we grew out of it, is paid for by an anonymous donor. So we don't have any expenses in our program other than food. So when
That's
you
amazing.
donate to us, you know that your money is going to food that goes to the community, to hungry children.
Right. You often see those pie charts where a big slice goes to administrative. There's none of that. All going back to the kids and their
Exactly.
families, really.
Yes, exactly. There's complete transparency in our organization. All our receipts are for food.
So, and I also noticed though, Jen, that you accept food donations, of
do.
course. So I've seen asks on Facebook, on Facebook. We're friends on Facebook.
Yep.
And I've seen you ask for, oh, we need oatmeal or we need this.
Exactly.
And you've made it very easy.
We
because,
have.
You go on Amazon, you click,
That's right.
You order it, you've done your good deed for the day.
That's right.
I really appreciate those posts because sometimes you want to help, but you don't want to send the wrong thing either.
Well, that's great. We really appreciate your donations. And we have an Amazon wish list on our Facebook page and 68 Hours of Hunger Nashua. As you said, there are 40 different End 68 Hours of Hunger locations. It is a nonprofit that started right here in New Hampshire. So most of the locations are New Hampshire based.
Oh, I didn't know that.
Yep. It started right over in Somersworth, New Hampshire. And so from there it grew out. There's about 30 locations in New Hampshire, and then there's a few in Massachusetts, and there's some as far away as California and Florida and Ohio, but mostly it's concentrated to the New Hampshire area.
Wow.
So, yeah.
I mean, it makes me sad that we have to have this, but it makes me proud of our state and of course of our city and the people that live here and the generosity of their support to take care of one another.
Very kind and generous.
Especially in a pandemic too. It really makes you understand it's really our civic duty to take care of one another and lift up those that are in more unfortunate circumstances than we might be.
That's right. Yeah. So
if I want to donate, is there a website that I can go to?
Sure. Yeah. N68hoursofhunger.org, and it's all spelled out. So you have to spell out N68 Hours of Hunger.
But use the numbers 68.
Yes, that's true. N68hoursofhunger.org. And right now, that generous anonymous donor from a year ago has stepped forward again and said that they will match.
This is great timing.
It is great timing, up to $12,500 again. So we have the potential to put up to $25,000 in the bank, which will really help because, as I said, our expenses went up and the number of children that we feed went up. So our budget is, nearly double what we used to spend on
Well,
food.
I'm glad that you have this donor that is helping you get through this difficult time and helping families get through their difficult time. So thank you so much for telling us about this. Again, it's N68hours.org. Oh, excuse me. I'm already screwing it up for you. N68hoursofhunger.org. Spell it all out. Use the 68. And thank you, Jen. Thank you for all you do for our community and
thanks for
helping the kids.
I was glad to be here.
And we hope you all have a great day and evening. And just a reminder that if you do need a COVID test, our COVID testing is still on Tuesdays from 3 to 5, but we will be moving back to the Elm Street parking garage. So it is by appointment. You can do that from an online appointment, or you can call our hotline at 589-3456. Thanks, everyone. Be well.
My name is Sheila Considine Sweeney, and I'm the Director of Integrated Care at Greater Nashua Mental Health. I was really happy that I was able to receive my first COVID vaccine a few weeks ago and looking forward to my second. I had minimal side effects, and I feel it's my responsibility as a leader at Greater Nashua to lead by example and do what I can in the community to help protect my staff, my clients, and my friends and my family. I know people have questions and you're nervous and you're stressed. There's a lot of great information out there. I consulted the CDC website as well as the Greater Nashua website and our infection control nurse and my own medical provider. And I feel like I made the decision that was right for me and right for my family. So I encourage you all to get educated and do your part to protect the community. Thank you.